Newcastle, home to over 273,000 people. A place where everyone can feel valued, especially those in need of extra help and support. Newcastle City Council is introducing a new way of providing social care to people in the city. This new way of working is called self-directed support.
Self-directed support is a system by which people can get the support that they need to live their lives independently as possible. It's the way in which we can give people choice and control over their own lives, and to make certain that everybody has got the best possible option for the care and support they need for the future.
We would ask the service user if they wanted any family or any other friends or whoever's important in their life, if they needed to be there with them. Going through, any particular needs or areas in their life what they may need some support with.
When your assessment has taken place, you'll need to make a support plan. This is a document that describes the support you think you need to meet your social care and support needs. It should put you at the centre and talk about how you would like to be supported and what is important to you. You can make your support plan yourself. Someone else can help you with it, or someone can do it for you, such as a relative, friend or social worker or care coordinator.
Once the support plan has been completed and it's identified what support is required, the social worker or care manager would go ahead and get that support plan authorised and get the money allocated to the individual to put that support in place.
Once your needs have been assessed, you'll be told how much money is available for your care and support. You may be asked to make a contribution to this. Once your support plan and money are confirmed, your plan can be put into action. Your plan has details of who will do what. Your support plan will be reviewed after 12 weeks and then at least annually to make sure it continues to meet your needs. When planning your support, you need to decide how you wish your money to be made available. There are several ways the money in your personal budget can be managed. A direct payment, an indirect payment, a service arranged by the council, a combination of any of the above. Graham is 17 and is using his personal budget to improve the quality of his life.
Needs are 24 hours. He can't feed himself, he can't get anything to eat, he can't get himself a drink. He's totally reliant on somebody being with him. Over the years we've had very little from social services, because they couldn't get agencies to provide for his needs because it was a children's services. We needed somebody to come into the home. Individual budgets, I actually employ the staff myself, and they actually come into the home and they support us to do daily living. So if Graham's fits are bad, then I know I can still take his sister to a horse, but we've got the correct support in the house to function as a family, and that's all we ever wanted. We haven't got set hours a week. I can use the budget and pay the staff, and I actually get more for the time, and I do all the payroll, but we do employ them as a family.
John lives at home with his mother Judith and sister. John is using his personal budget to pay an agency to provide support for him.
My name's called John Robson and I'm 34.
Well, before we got the personal budget, me and John were more or less housebound. I was like a full-time carer. I didn't get any respite care or anything. Like with having this in control budget and being able to take all of these options on, which we didn't before, we're now meeting loads of other people and it's like a whole new world. He's like a different lad to what he was before we got the budget. He's more what he used to be like when he was about 18 or 19, because he was outgoing. I know how much I've got each month for John, so I plan ahead as to what he can do with this money, so it's worked out better for me that I've got it.
Well, I'm Titty. I'm 66 years old, and I've had MS since I think I was 41. It'll be about allowing me to do the things that I want to do rather than the things that I've got to do. So I'm actually going to be able to, for example, I'm going to be able to look after my grandson one afternoon a week without my unfortunate husband having to be there. I am going to choose my PAs, and I am going to even decide, to decide the hours that I want them to do and when I want them to do those hours, to decide on the terms of their employment, everything. It's me. I'm choosing.
Newcastle City Council is committed to the idea of making sure that everybody can live their lives in the way that they want. We want people to be able to take part in an effective choice about their own care, their own support. Their carers need to be involved in that where it's appropriate, and everybody should get the chance to really take charge of their own lives in a way that hasn't been possible before.
Find out more about self-directed support and how it can bring choice and control to your life. Visit us online or call us